This is our first press briefing in the month of June. So we're now officially in the 4th month on the calendar of dealing with the coronavirus in North Dakota. And as we'll cover in just a moment, A lot of numbers pointing in the right direction, so I want to start off with some gratitude right away to all the leaders around the state who participated in taking early and decisive action at all levels of government, and the individual responsibility that's been exercised by our citizens and our businesses, and that covers everybody: counties, cities, school boards, mayors, county commission, our tribal leaders, and we're honored to have Chairman Mike Faith here from the Standing Rock Sioux Tribe, and Scott Davis, Executive Director of North Dakota Indian Affairs Commission. They'll be both speaking a little bit later to also talk about great work. But we have been working across North Dakota all together in a team effort, and this has allowed North Dakota throughout the challenge that we were going through, the pandemic, to be among the least restrictive states, and it's allowed us to be a leader in lifting restrictions sooner than others. And so we've been leading on both going in and coming out of this, and I want to say again, thanks to all North Dakotans for exercising great individual responsibility. That's been a key factor in what we've been doing here, so thank you, and great to see so many North Dakotans out and about as we move towards getting our economy back towards full recovery. We got some great numbers to share, and we'll take a look at those. This is the longest we've gone in having a press briefing. It was 5 days ago on Friday, so it's the longest since we've started having the press briefings. So a lot of ground covered in those 5 days in between. But let me just start out by saying that again, with the 33 additional cases reported today, out of 2,626 tests, that's a 1.3% rate. But 5 of the last 7 days have had a daily positive rate below 1.4%. That's the best we've done through this entire time. And of course, some of this now is coming 5 to 10 days after Memorial Day weekend. There was a lot of concern around the country, a lot of press reports about all the activity on Memorial Day weekend would cause a spike, and I'm happy to report that it has not caused one in North Dakota. We've now completed more than 100,000 tests, so we've completed 101,327 tests of North Dakotas, and that includes 74,502 unique North Dakotans. So we're closing in on 10% of the total population has been tested. We remain in the top 5 states in testing per capita. A number of other states are really ramping up their efforts, and so now we find ourselves behind New York, over Rhode Island #1, New York and New Mexico are also ahead of us, and so we're in 4th place right now. But why do we focus on testing, and why do we always lead off on testing? Well, testing is key to building consumer confidence. If we're going to fill schools safely and protect both the teachers and the students at K12 and the higher ed, if we are going to fill stadiums and get back to enjoying the activities, whether it's rodeo or football or baseball or soccer or track meets, whatever it is, if we want to do that, the key to getting back to that is the consumer confidence and the understanding of the officials that we're able to do that safely for the participants and spectators, concerts alike, all of this. So that's why we continue to build our capability on testing, and why we continue to focus on our ability to identify those positives and then trace and isolate those. This week at the lab, we talked about this, but 2 more of the new machines, Panther machines, came on earlier this week. They're called random access machines, and so you don't have to load them in a batch. You can load in while they're operating. This gives our state lab now the capacity to do more than 4,000 tests a day, and so the capacity is there, as you saw in the numbers, that we only had 2,626. Part of this is, I think, as we head into summer, there's a lot of distractions, and people may be prioritizing less testing, but we need to make sure that capacity in the lab is just one of those components. We also have to work with local public health to make sure we've got the appropriate strategies for reaching those individuals, including those that are most vulnerable or those that work with the most vulnerable or those that want to visit the most vulnerable. And then we need to make sure when we have those strategies that we are doing everything we can to make participation easy, whether that's increasing the number of our locations where we offer testing, do a better job of working with our medical providers to make sure that people who want to get tested can. We still occasionally hear that some people have been turned away for testing. I hope this is not the case. And if you are anywhere in the state, be sure to reach out to our Department of Health and let us know because we want to make it easy for people to get tested who want to get tested. On the next slide, we've had this up before, but again, this is available in an interactive way on our website at health.nd.gov. Where to get tested shows locations around the state, and these are not like temporary or drive-through. These are local, either public health or medical providers or clinics that are offering testing. But again, you can reach out or call the health hotline. If you got questions, we can help you make sure that you get tested. Today's testing also includes 825 newly tested North Dakotans and about 1,801 repeats or serial tests. And again, a chunk of this activity around serial testing has been us trying to wrestle the virus to the ground within long-term care. And we're encouraged to say that Monday's results, for the first time since we began serial testing, there were no positive cases were identified in either long-term care residents or staff. That was from Monday's results that were reported yesterday. Today's results, which was Tuesday's testing, there was, again, a second day in a row, 0 new residents in the state of North Dakota in long-term care with COVID-19, and only 1 positive case identified in a staff member. And again, that's there are lots of tests going on in long-term care and large populations. There's about 9,500 people that are in either assisted living, base care, or skilled nursing in our state, and about 15,000 people work full or part-time in those facilities. So this is a big sets of people, and we've gone through all of those individuals have been tested at least once. And again, great work that's going on. So thank you, Chris Jones and the VP3, the Vulnerable Protection Plan team that's doing that, because great progress being made in long-term care, and there's been great work all along in our corrections systems and others where we've had very low incidences of this. So that's fantastic. But it's great not only to see the low numbers, but we also know that one of the great concerns in our state is for those families who have loved ones in long-term care and have not been able to visit them. And I'm sure it's both for me and others personally, it's both a huge sign of relief, but it's also filled with gratitude to see such low numbers in long-term care. And I know it's a relief for family members who have been anxious about reconnecting with their family members, because again, these low numbers and getting to 0, if you will, is part of what we described last Friday in terms of the gating capability to get us to start opening up under some North Dakota SMART guidelines about how we can begin visitation again in long-term care facilities. So all these numbers tell us that we're on the right track. When we get to the net case breakdown on along with the 33 new cases, there was 42 recovered cases, and which is, and sadly, 1 death reported today, and we're now at 444 active confirmed cases. Since we met last Friday, 7 individuals have passed away with COVID-19, and all of them were in their 60s or older, some in their 70s, some in their 80s, I think 1 in the 90s. Each of those 7 individuals that's passed since last Friday also, in addition, had underlying health conditions. And for the man in his 70s from Cass County, who's included in today's report, and the other 6 individuals, our hearts go out to them and their loved ones, and all of those who have suffered a loss through the COVID-19 pandemic. From a hospitalization testing standpoint, again, part of what this is all about was preserving the hospital capacity. Only 34 people are hospitalized, and only a portion of them are in ICU. And so again, we move forward with confidence and optimism because we have great medical care in our state, and we have the capacity, plenty of capacity to serve people at the highest level if they were to become infected and seriously ill with COVID-19. When we take a look at the active case trends versus just the raw number, we can see this is also heading in the right direction. It is on a 14, or just on a pure basis, is down to 444. We have not been at this level. You have to almost back to May 1. This is almost 90 cases lower than we were last Friday, and again, close to the lowest levels we've seen since the beginning of May when we began to open things up. And so again, when we opened things up, we took on a little bit of risk, but we managed our way through it. We did more targeted testing. That also drove some of it up, but we're on the right side of this curve coming down. So again, I say, great work, North Dakota, on all of this. When we take a look at the positive rate, which is important, not just the raw number of cases, but on the positive rate, we can see a very good trend line on the top. In the red line, we've got Cass County, great trend line there over the 14-day, coming down from a high of over, in the 7s down to 4.9%. North Dakota as a whole, including all of those Cass County numbers, is 2.1%. And again, we like the trend lines there. And as we take a look at Cass County, where we've been challenged there, also the 66 deaths that we've had in North Dakota, 55 of those have been in Cass County, and quite a number of those associated with individuals in long-term care. So again, emphasizes the importance of us really making sure that we're protecting our most vulnerable population. Next up, we want to talk about tribal testing and support. As you know, tribal engagement is one of the 5 strategic initiatives of our administration. We've been absolutely positively focused on that since the first day we were sworn in mid-December in 2016. It's remained a priority throughout the COVID-19 pandemic. In partnership with the tribal nations with whom we share geography, we've completed the first round of testing across the state. That included at the MHA Nation, Spirit Lake, Turtle Mountain Band at Chippewa, and also the Trenton service area, which is part of Turtle Mountain, the northwestern part of the state, and then also most recently down with the Sisseton, Wahpeton, Oyate in the southeastern part of the state. Here today to talk about the collaboration that occurred down at Standing Rock is Standing Rock Sioux Tribe Chairman Mike Faith, and also Scott Davis, who's the Executive Director of North Dakota Indian Affairs. I think Scott's going to kick it off, and so we'll invite Scott up here, and after that we welcome Chairman Faith. Thank you both for being here in person, and thanks for the great collaboration. Scott, I want to say thanks to you too as you come up here. You've been working like 7 days a week, 20 hours a day on all the things related to staying engaged with all of our tribal nations, and on behalf of all of us, I just want to say thanks. Thanks for your leadership. You're an important key in these relationships. Scott Davis.
Well, thank you, Governor. Thank you very much for those words, and all this for your commitment to our 5 tribes in North Dakota. It's been certainly a very strong ride, I'll say. It's been very productive. And so good evening, good afternoon, everybody. North Dakota, Petuashte, Scott Davis here. Just want to provide a little update here of our, as the Governor alluded to, the mass testing days that events we've had here, beginning with MHA. Seems like months and months ago at times, but it was a couple months ago that we started that process, that commitment, in partnership with the 5 tribes of North Dakota. And it all began with those phone calls, the outreach from the Governor's office, my office, and making sure that the tribes were set and ready to begin a process regarding this pandemic. And since then, that hasn't changed. We still continue those weekly calls. I'm so thankful for my chairman. I'm a proud member of Standing Rock, and my chairman is here with his staff to share, what they've been doing, the amazing work they've been doing down Standing Rock. So that commitment from the governor's office, the cabinet members, the Chris Joneses, the Department of Health, Unified Command. I mean, there's so many people involved in these processes, and also the local public health that they'll talk about too. I got Custer Health down where we're from. Amazing people to work with. So I can't say enough of how strong this partnership has been in the months during this pandemic. So again, if you look back when this had it, everybody declared the national state of emergency. Governor, as a chairman of a sovereign nation, they do the same thing. And it was at that time where it was talked about how do you declare in unison in making sure that those resources were going to be provided to the tribes. And there's a little bit of, I guess, a little difference when a chairman decides to declare under the president versus declare in unison with the state, with the governor. And in this case, the tribe decided to declare with the governor and the state of North Dakota. And what that meant, and opened up to a lot of resources for the tribes very quickly. And we've seen that process work very effectively. When you think about PPE, equipment, gloves, masks, gowns, and most importantly, testing kits. Those have been readily available to our tribal nations here in North Dakota when asked. We make weekly deliveries from my office. My staff has made multiple deliveries to every tribe, and I think we have a few more pending, as the chairman will talk about here shortly, but those things will always continue. And so when we get to those testing events, it's pretty amazing to see the resources that the tribe has laid out for the Unified Command with the medical team. Boy, I tell you, from Game and Fish to the law enforcement to the Unified Command people itself, the nurses, the doctors, law enforcement, you name it, they are there to help support our National Guard in providing those tests. So it's an amazing thing to see. And people just line up from the districts within our reservations, and once we get going, it's a pretty I'll have to say it's a smooth running oil machine, and that just shows the commitment and the partnership that has on the ground there. So just a little overview of the data that the governor alluded to. And as we all know, my boss, he sure loves the data, and so it was my goal at the end of the testing events that we would compile the aggregate data of how many tests were conducted, because again, we provide those testing kits to the tribes, and we track those for good reasons. And so this slide that you'll be shown here shows the data set of how many tests were conducted. And there's twofold for that. One is the testing events on the tribe, and also we've included the urban populations as well. As we all know, the Fargos, the Bismarcks, Mandans, Grand Forks have high populations of Native American urban tribal members in those cities, so we included that. So as you see, there's roughly 3,386 tests that were administered, and out of those positive were 129. And again, we're including the urban population on that too. So a percent of positivity is 3.7%, and I think those are very, very amazing numbers. But when you think about data, and as we all know, the very slides and the matrix that we are in tune with. We can certainly help the tribes really get into the data weeds, if you will, of the data matrix. So we can easily help the tribe in consultation, if the tribe so chooses to get really in depth of your numbers per tribe, per district. I know that's been talked about, that I've been told from tribal leadership, from Unified Command people, from of where those numbers are at per district, per segment. And I think that is a very important thing to note when you think about your data, whether you're a state government, city government, tribal government, because without your data and knowing where those numbers are at, where they're located, where they're coming from, it seems like you're almost in a guessing game. And I've heard firsthand experience on some of the calls I'm on nationally that the viruses in the country are still somewhat unknown, because of data sharing, because of resources. So by all means, if the tribes want to pursue, a further next step of a data sharing agreement, we have the resources, we have the capabilities and the matrix to help the tribes if they want to continue those data sharing agreements. So again, it's just a very important time, I think, in Indian country, as we say, as tribal members, where we're at through this pandemic, and how much hard work we have done, Governor, on this, and Chairman Faith and staff. Prior to COVID, here we worked very, very hard on relationships in this state. I got to put a shout out to your missus here, Governor, First Lady. She was asked here to do 2 commencement speeches, one at Sitting Bull College and one at Turtle Mountain, and that has never been done before. So kudos to the First Lady of being asked to do the commencement speeches for Sitting Bull College and also Turtle Mountain Band of Chippewa. So I'm not sure if you've been asked yet, Governor, but she might have a couple up on you already here. So that's good, though. But Catherine is an amazing lady, amazing leader, and I'm sure she's going to do very well with her speeches with our tribal nations here in North Dakota. But again, in spite of what's kind of going on in the world and our nation with some unrest, I think it would be of value for the nation to look at North Dakota and look at how we have really worked hard on respecting communication and understanding tribal nations here in North Dakota. And I'm certainly very, very grateful for my chairman, my council, the tribes in North Dakota, Governor, your leadership, and how peaceful it is in those relationships, those communications, those talks, weekly talks. I mean, it goes a long way. It goes a long way, sir, and I can't thank you enough how much that means to me personally as a tribal member of Standing Rock and Turtle Mountain. So with that, I'm going to turn the mic over to my chairman, Chairman Mike Faith. Chairman's been in leadership for a long time. Even when I worked for the tribe back in the 90s, he was there, and I'm certainly, we communicate a lot daily, weekly on a lot of things. And I know he has his team here, Margaret Gates, who is like a sister to me. We're about the same age, roughly, but I don't want to say our age, but if you know Margaret, she's the health director down at Standing Rock, does an amazing job, one of the leaders of the Unified Command. Very tough job. Very, very tough job. And she also brought her daughter, Shauna, along with her. And if you remember in the basketball ranks, Governor, as we are basketball fans, Shauna was a standout student athlete in basketball in North Dakota, one of the highest ranking, I'd say, in history of women's basketball in the state. She went on to play ball in Texas, and now, as we're all taught, she is coming back home to bring her leadership skills and her work ethic to the nation of Standing Rock. So I'm very proud of her, too. Of what she brings to the table for us here. So with that, please welcome Chairman Faith.
Abeta Washte. Good day. Governor, I want to take this time to thank you. Scott, I want to also thank you. Again, the Governor mentioned teamwork. I agree with him so much on that. You can't get any place without teamwork. I'll mention a few things that happen on Standing Rock as I go on here, but when we had the testing down at Fort Yates, our long soldier, Governor allowed the guard to come down, allowed the North Dakota Health, and of course our Indian Health Service was there, and then of course our Incident Command and our Standing Rock Homeland Security Task Force heavily involved in that testing. And what I saw that day was good planning, professionalism, a lot of it. And again, it was from both sides. We were there to do a job and find out where we stood as far as the virus. So again, Governor from Standing Rock, I want to thank you very, very, very much. Again, Scott, you and your office. Again, we also asked, reached out for supplies. Once we did that testing, we caught on to that pretty fast. So our incident command, our task force, and IHS, if we got the test, we could do on our own. And we showed that that could happen. Since then, from that day of the testing at Fort Yates, we've done 1,364. Of that, 97 is pending that were taken yesterday in Cannibal, North Dakota. Tomorrow, they're going to be down in Bullhead, South Dakota. Next week, hopefully, we're up in Porcupine and wrapping up our 8 communities within our district. So again, I'm going to be calling on Margaret to come on up in a bit here to give us some numbers. And again, you know, take it as it is. It's that's a pretty good, when you look at Standing Rock, 2.3 million acres. That's a pretty good size chunk of land, a land-based area. So to get out there and do testing and to turn around is getting to the point where it's very, very quick. So our Indian Health Service working with the North Dakota Health, doing a fantastic job. Of course, the governor's staff, along with Mr. Davis, are truly a wonderful help for our tribe, because supplies coming down, masks, gloves, whatever we can use and whatever is available is given to each tribe in North Dakota. But again, before I turn it over to Margaret, Scott already did the introductions over there, so I am proud of our employees at Standing Rock. Again, we have our essential employees working, our non-essential are at home working. So again, it's not a vacation. It's something that's we have to take very, very serious, and we have to practice that. You know, the social distancing, the cleanliness of the hands. We have to preach that also. You know, we practice it, well, we have to preach it. So again, you know, staying at home, stay safe, save lives. It's pretty simple for right now. Our life's changed within the last 2 months, so the norm is almost what it is today, is health concerns and watching out for the best of our young ones and our Takojas, the grandchildren yet to come. It's so important. The home learning technologies, that's going to be the norm. And I tell you what, that is, the kids enjoy that. So it's still not a vacation to them. We're going to be having ours graduation at Standing Rock Community Grad School. And again, you know, the student body there is probably around 650. So, you know, with the graduates, we're looking at the latter part of June. But again, social distancing and all that, practicing that is what we're looking at. So again, Governor, I want to, on behalf of Standing Rock, thank you for allowing us to be here today, but also thank you and all your employees that are helping Standing Rock in a good way, and also the other tribes of North Dakota. I know they would reach out to you and say thank you in a good way also. So with that, Governor, I'm going to ask that Margaret Gates come up. She also, like Scott said, was the tribal health director, but also we put her in charge of the incident command, which again, the structures under that of others are in there, planning, logistics, and whatever as it goes down. But she inherited this, and she's doing a very, very good job at it. So, Governor, at this time, I'd like to turn it over to Margaret to give you some better numbers. Thank you again.
Good afternoon. Thank you, Chairman Faith. Thank you, Governor Burgum and Scott Davis. I just want to say again, reiterate what the chairman has said. Back when this started in March, we did the declaration, and the chairman put the incident command in place, and from that we devised our plan and our mitigation plan and strategy, and that was first and foremost to protect our elderly and our children within our reservation. And from that plan, we developed different stages and trigger points, and where the testing fell into place when we had all the conference calls and different discussions with the state of North Dakota, with Scott's office, with the governor's office, and our leadership. That's when we did devise the plan and go forward with the National Guard to set up the mass testing, and we've kind of followed from there. As a team, we weren't sure what to expect ourselves, and everything, like Chairman said, fell into place. And from the team we have, I want to give a shout out also to our ICS team, without forgetting anybody, but everybody that's there, from our Tribal Roads Department, Game and Fish, law enforcement, different departments, our EMT, our ambulance staff, IHS, Indian Health, Public Health, Nursing, everybody that is there, those behind the scenes that help, our PIOs, our chiefs in the different departments, everybody came up with the plans and followed everything that we learned from that day. So from May 9th to even yesterday and tomorrow, we will be testing and wrapping up our testing next week, and just getting that sampling from our local districts, because like Chairman said, that 2.3 million acres, the biggest part that we seen from the May 9th test, again, the weather played a factor. We had snow. Good old North Dakota, we had some snow, and a lot of our people, transportation is an issue for us. We have 8 communities which are in North and South Dakota, and what we wanted to do is be able to take this testing out to our people. And what held us up as a tribe was the testing supplies, and working with Scott's office and the governor's office and IHS and that teamwork, then that collaboration that we built with the National Guard, we were able to establish that partnership, and now that just seems to be working. So like the chairman has stated, we've totally tested 1,364 tests, 1,263 negatives, 97 pending from yesterday, 4 positives, 3 recovered. And Standing Rock is in 2 states, as we know. Sioux and Corson County are our counties, North and South Dakota. So sometimes that can be a challenge for us, but we didn't let that stop us, and we continue to work with the state of North and South Dakota and with Scott's office to try to provide the testing supplies so we can keep moving. As of, we said, the May 9th, we did 482 tests. Bear Soldier, which is in McLaughlin, South Dakota, we did 134 tests. Running Antelope, also known as Little Eagle, South Dakota, we did 84 tests. Kennel, South Dakota, 52 tests. Wakpala, South Dakota, 100. Cannonball, North Dakota, 97. And we have Rock Creek remaining, which will be tomorrow, Porcupine, and Long Soldier. Because again, when we went back to the testing, we followed everything along the guidelines of CDC and also what the states were doing, and we broke it down into 3 different phases, and also into our plan that also lined out of how we would do the testing. So we followed along and did the essential testing that day on May 9th, and for us, our essential is almost all the tribal workers, and by then we had already shut down the working part of it, and just following along the guides there. We invited all the police officers, the Corson County, Sioux County, all our IHS staff, public health nurses, EMT staff, and the tribal workers that the chairman and the emergency response deemed as essential staff. And what's unique about the reservation is, as we shut things down and put the plans in place within our own communities, we developed our strike teams, which is our district offices within the district, and those people had their essential staff. We had those people also test, and that's where we shot for the 500 to test essentially. From that, we moved into each of the districts and the phases, and to try to get everybody tested to do a sampling. So once we get that done, something else that has been established now, as we know, our casino has opened, and we're gonna do some random sampling as we wait a couple weeks to see how things are going, just as long as the opening up start to happen, is to be able to follow their guidelines that they put in place. And they also have a gaming commission that has developed and worked with the team to get those plans in place and the safety precautions that they follow for their employees as well. And then with IHS and public health nursing, we'll go in and do some sampling within both of the casinos that we do have. So with that partnership that we've built and continue to build, we want to continue to do the testing and see where we're at. And again, like Chairman Faith has said, I really want to commend our people of the Standing Rock Nation, because from the time this started, again, this is something against a fight that what we say as Dakota people is a virus and something that we cannot see. So you're fighting against something that you're trying to protect your people from. And that made us try to take every precaution that we can take. And I think with that, are people taking it serious enough to where they are staying home, they are staying within the boundaries, and as they feel better and safer, then that plan to start opening up may start to happen. And that's about all I have. Thank you.
I want to say thanks to Chairman Faith and to Margaret. I think everybody listening to the two of them understand that we've got great leadership, great strategies, and great execution, and that's what it takes to win this battle. And as on behalf of all of us, state of North Dakota, the Department of Health, the National Guard, Scott and his team, and the governor's office, everybody, we just want to say thanks for the partnership, because it's been fantastic. And I know that I don't want to say the nation's watching, but I know the nation is, and they see this as what's going on in North Dakota as a role model for execution. And I also know from speaking with other governors in other states, when they've been dealing with some outbreaks, some of them have reached the national news in the Navajo Nation and Arizona. Number of challenges. Wind River in Wyoming had a large outbreak for a while, and of course it becomes when we're trying to protect both the elders and the young ones, good strategies, good execution matters, and we're very grateful. So on behalf of the First Lady and myself, we say thank you. And Scott, to your remarks, yes, the First Lady's been invited to two graduation announcement, and I'm 0, so she's leading 2-0 on that already. But and I think that lead's going to continue to build, and I understand why. I'll keep cheering her on. She's doing great work as she tries to help eliminate the shame and stigma of the disease of addiction with such courage. But with that, we're going to move to our next topic, which is relates to a K12 executive order. Last Wednesday, I signed Executive Order 2020-33. This related to K12 funding and the ability of school districts to carry forward their ending balance at the end of a school year, which is coming up on June 30th. That executive order a week ago was solving a big problem, which was that COVID dollars, as we understood it a week ago, nearly $40 million was going to come into the schools through the CARES Act. If that money, as we understood then, needed to be distributed immediately when it hit those books, probably wouldn't have been able to be spent by the end of the year. If it was then increased their ending balances above a certain level, above 45% of their operating expense, that would have triggered a clawback, if you will, through state legislation. If that clawback occurred, that would have been a reduction in funding, and the reduction in funding would have negated the entire allocation in the first place. So there was a catch-22 between the federal dollars that were coming in to help protect students and teachers related to federal public health dollars going directly towards K-12. Since then has been the case in a lot of the rule guidance coming from the feds on all kinds of economic assistance. In some cases, like with the stuff coming out of Treasury, there have been over a dozen updates. In this case, in the last week, there's been rule guidance clarification that now allows us in the state of North Dakota, the dollar amounts haven't changed. It's still $40 million going to 175 school districts, but they can be utilized through reimbursements rather than direct grants. That allows us to do reimbursements in next fiscal year as opposed to this fiscal year, which essentially removes the need for the executive order. The problem that we had fixed with the executive order no longer exists. So this executive order 2020-35, I believe, is the new one today, is very short and simple, and it says that it rescinds 2020-33. So we are rescinding that. And again, I want to thank the legislative branch, the legislative leaders, the chairmen of the education committees, people from the education community who worked with us both going into this fix last week and coming out of it now when we no longer need it. And we'll continue to work with legislature to determine how to address things going forward. There is a potential small issue with 15 of the 175 school districts. It's a $2.5 million issue. We believe the legislature legislature is best positioned to handle that through legislation when they return next year, and we'll continue to collaborate with them. But thanks for everybody as we solved the problem and now have rescinded the executive order because the problem got solved with a different way with clarified guidance. Next topic, Paycheck Protection Program update. This is the Paycheck Protection, as I'm sure you know, is part of that initial CARES Act. Initially, $350 billion nationally of funding for small businesses through the PPP, as it was called, the Paycheck Protection Program. Another $310 billion in the second round. And you might say, why were those numbers so large? The whole concept behind this legislation was that they would help support businesses that were closed due to the virus, and these loans became grants. Up to 75% of it became a grant if the money was used for payroll. This is a way to keep personnel and capability, keep businesses running, even though their revenue may have been off, and it was also had the potential to save taxpayer dollars by keeping people working for their employers versus applying for unemployment. These programs are very effective. As of June 1, 19,000 different North Dakota businesses and eligible nonprofits received $1.7 billion in paycheck protection loans. And we're grateful to the hard work of our local lenders and the Commerce Department team and the Bank of North Dakota for making this possible. As you may have read even in the national news, that North Dakota received an outside share of the first round of PPP loans because of our ability as a state to collaborate, move quickly, and work hard, traits that I think characterize our entire state. But again, part of this was the great working relationship between Commerce and Bank of North Dakota, and a great working relationship between the Bank of North Dakota and our wonderful community banks that are across our state. Again, the PPP, there's a portion of that which is eligible for loan forgiveness. The program was designed and originally delivered loan proceeds spent during the covered period, which was 8 weeks following the loan origination, for salary and benefit costs to keep employees on the payroll, along with certain qualifying expenses like mortgage interest, rent and lease payments, and utility payments, the kinds of things you need to keep your doors open. Those were all eligible for forgiveness. As long as 75% of the PPP loan went to fund payroll and benefits, the remaining 25% could be spent on other eligible expenses during that same time frame. That was then, way long ago, in a month or two. This week, the House passed the Paycheck Protection Flexibility Act, which, as we discussed in the previous topic, changes the guidance. And this, I think, changes it favorably. Key word here is Flexibility Act. This will extend loan forgiveness for expenses up to 24 weeks, removes limitations that restrict non-payroll expenses to 25% of the loan, and other changes. There are alternative versions of similar legislation that may be reconciled in the coming days or week. These changes, if passed, would have a material effect on the eligibility of different expenses for loan forgiveness, and would have the positive effect of likely increasing the amount of these 19,000 North Dakota businesses of what is eligible for the forgiveness, and it could change those substantially. The timing of the action required by the House at the House having passed at least the first version of it, getting it through a version through the Senate, getting them reconciled is key, because it has been slightly more than 8 weeks since the first PPP loans were originated, and businesses who received those early PPP loans are likely preparing what was called their loan forgiveness applications. Well, we wait for the outcome of the proposed legislation of the Paycheck Protection Flexibility Act, if that can get passed. We're not certain, but it's important to know that the Small Business Administration, SBA, has not set a date for businesses to submit its application for loan forgiveness. Because of the changes currently being contemplated by the U.S. Congress, North Dakota recipients of the PPP loan should consider waiting This is one of the first times I can remember that we're talking about going slower than faster during this, but we do recommend to those 19,000 businesses you consider waiting to submit your loan forgiveness applications until these bills have made their way through Congress. If you have questions, we encourage you to consult your lender, who is your loan originator, or talk to your accountant or others for guidance to your specific situation. And you can find details related to this and links to the loan application form as it currently stands and worksheets at ndresponse.gov under the Business and Employer Financial Resources tab. We'll be announcing soon, there'll be, as we've done throughout this, there'll be another call that will host the North Dakota Department of Commerce and the Bank of North Dakota will host a call-in for businesses across the state to get more information as it becomes available. But again, if you've got a PPP loan, we recommend you wait before you submit your loan forgiveness application. There could be some good changes coming. And if that wasn't good news enough, we got our next section is actually called Good News, and we are always excited to recognize and promote young entrepreneurs that are making a difference in North Dakota today, and we want to share some recognition for the young leaders in the Fargo-Moorhead West Fargo Chamber of Commerce Young Entrepreneurs Academy. YEA exclamation mark is there is YEA with an exclamation mark is pronounced yay, and yay is a 25-week-long program providing students the opportunity to work with local and business community leaders as they learn to transform ideas into real, tangible companies that create economic and social value. Students across the Fargo-Moorhead West Fargo area are able to participate and compete for funding today at 1 Million Cups. And if you're not familiar with 1 Million Cups, it's a hour and 15 minutes of caffeination as in cups of coffee. It's a weekly gathering of entrepreneurs, innovators, and community builders. They come together. Today they had the opportunity to hear from 2 graduates from the YEA program about their businesses and experience. And over the past 5 years, Fargo-Moorhead West Fargo's Chamber's YEA program has had 60 graduates. 40% of those graduates still run their businesses or have gone on to start other businesses. And we encourage everyone to go check out the 1 Million Cups, 1millioncups.com, and one is a numerate in that thing is a number, not a spelled out. It's the number 1 and then millioncups.com/Fargo to learn more about these young entrepreneurs. I know that their program today, 1 Million Cups has been doing a number of things virtually, and so you can don't have to be in Fargo, and you can tune in and watch this and see about educating, inspiring young entrepreneurs. There's also 1 Million Cups that's very active in Bismarck. 2 great organizations doing great work, and you can also visit the Fargo-Moorhead West Fargo Chamber.com YEA for more information about YEA, because maybe there are some other communities that want to adopt that program. We certainly, coming out of all of this chaos and disruption, there's going to be so many opportunities for entrepreneurs and innovators who can come up with new approaches and new business models. There's never a better time to be an entrepreneur than at a time of disruption. The next topic is behavioral health update. And the state is continuing its efforts to address pandemic collaboration with local leaders in Red River Valley. And today, with a tremendous amount of gratitude, we want to share efforts of the Fargo-Cass Public Health group called the Harm Reduction Division. The Department of Human Services from the state of North Dakota provides funding to the Harm Reduction team to offer mobile outreach services for individuals with behavioral health needs. This service has been essential in meeting the needs of North Dakotans, especially those who've been living on the fringes during this pandemic. Individuals who may have been in a situation where they have both behavioral health needs and addiction needs and perhaps housing needs. If they were tested positive, they may have found themselves in a mandatory isolation or quarantine. And again, the mobile outreach team became a vital link in providing support to them. Specific efforts provided by the mobile outreach team since the beginning included they provided support for 300 people in shelters in Cass County. 80 individuals have received transportation, such as services to get tested, go to a temporary shelter, or get to the hospital when symptoms worsened. More than 100 individuals were provided with outreach services while in isolation or quarantine, either in their homes, at shelters, or other locations. Daily deliveries of food baskets and hot meals to individuals or families in quarantine at shelters or in their homes who may not have had a way to receive food. Daily symptom checks by public health and keeping track of these individuals. Again, harm reduction team has been working together to constantly identify people who are at risk and connect with these individuals. And again, this is the smart conservative approach, because in doing this and treating these challenges as healthcare needs, we can help these individuals stay within the healthcare system as opposed to in the correction system, and that saves taxpayers lots of money and helps them with their family and helps them perhaps find a road to recovery. Lastly, on a few occasions, it's the mobile outreach team members that were able to lay eyes on some very sick people that ended up being hospitalized immediately. So again, we know that their actions have actually saved lives during this pandemic. Department of Human Services will continue working with the Harm Reduction Division to provide additional resources to ensure that these vital resources continue to meet the needs of those impacted by COVID-19. And we are grateful to the work of the Harm Reduction team and want to thank Team ND and the team members of the Harm Reduction team and the North Dakota Behavioral Health team for all their innovation, all their passion to so smartly serve all North Dakotans, even those that may find themselves in such a challenging position. So there was a gratitude component in that as well. So we'll wrap up our gratitude to the efforts, the successful efforts of the Fargo-Cass Public Health Harm Reduction Division in the state of North Dakota with a quote. And this comes from 93-year-old Benedictine monk David Stendal Rast, and he says, "If you're grateful, you act out of a sense of enough and not out of a sense of scarcity, and then you are willing to share. If you are grateful, you're enjoying the differences between people, and you are respectful to everybody. And that changes this power pyramid under which we live. It doesn't make for equality, but it makes for equal respect, and that is the important thing." So again, great words on gratitude, important words for this time right now from 93-year-old Benedictine monk, David Stendal Rast. With that, we'll stand for questions. But before I kick to that, I do want to say we are going to be back here on Friday for another briefing. Friday's briefing is moved up till 3 p.m. on Friday, so we'll hope to see you then. And again, if you're signing off now, thank you for being North Dakota smart, and stay healthy, stay connected, stay informed, and thanks for continuing to practice the North Dakota SMART guidelines. With that, we'll stand for questions. And again, Scott Davis, Chairman Faith, and Margaret are all also available for questions as needed. And I think I'm going with Dave first, then Lane, and then back over to this side.
Governor, first, when you talked about million cups, I thought you were talking about my coffee consumption in the morning. But can I ask Margaret a question?
Absolutely. Margaret?
You had mentioned sampling. Is that going to be done at the casino, and how is that going to happen?
Right now, our testing happens from the state of North Dakota. The Department of Health, I believe, gets the tests down to the Indian Health Services, and then we'll be going directly into the casinos with the public health nurses. We don't have all the details, out yet, but what we want to try to do is be able to cover all those employees at both casinos. So I think the amount of employees total it just roughly is about 420 with both casinos. So we want to be able to cover both of them. And some of them may have been covered in the mass testings, we're not sure, but we were closed at that time. So we want to get that feel once they've opened, give it a couple weeks or so, and then start going in.
So specifically, it's for the employees?
Yes. And it'd be similar to how we do regular testing for any STIs or anything that we do. The Tribal Health Department works with IHS and Public Health Nursing, and we do go into the jails, we do sampling, we do testing and provide that throughout the districts.
Also, follow-up if you have a moment. Perhaps this is readily available online, but what are some of the precautions that you're taking at the casino?
Right now, I don't have all those details, but I could advise you to go to prairienights.com. On there, there's also a link that you can follow that has a COVID-19 page on there that has their guidelines specific to there. I do know it pretty much details everything that you have to follow in order to be a visitor there. Yep.
You mentioned weather playing a role in transportation issues on May 9th. Wondering if transportation has played a role in resource deployment or data collection outside of that event.
That's something that we did today. I'm glad we came up and visited with Scott about on the data collection that we do have. We do work that through IHS, but trying to look at a bigger breakdown for that, and that's something that we're hoping to build within the tribes ourselves.
I'm wondering if transportation issues have been a common theme or if that hasn't been a problem thus far.
I think when we go out into the communities, we're right there within walking distance. So we've had several homes, several people, families walk up to the testing sites. So that makes it unique for us to be right there within those communities because a lot of people don't have that transportation. Yep.
I've got one more question for you real quick. How many residents are there on Standing Rock?
Roughly close to, I would say more like 9,000, but 8,975. Yep. Yep, North and South Dakota. Thank you.
Thank you, Margaret. Stay tuned. They may not be done with quick questions. Lane?
Governor, I figured I'd start off with people have started to recognize me now as the guy that the governor gives grief to over his sports teams. So that's been fun to hear the past week. But question is, we've heard from several of our Minot visitors that they're frustrated that the mass testing in Minot took so long to get up there. And they were wondering what played a role in choosing what cities got mass testing and which didn't.
Well, I would want to say again, if you go all the way back to the very beginning, there was a few positives in Ward County when this thing was first started. Then they've actually had very good numbers throughout. And there's always been available local testing through Trinity and through the clinics and through others up there. And so I feel like that, you know, Minot and the Ward County has been one of the places where this has been under control. We were up there, of course, testing all of the nursing homes, residents, and staff. There was a testing event that was up there, and I know that the testing team is meeting tonight to think about how do we think about sort of round two, how do we go into June, and how do we drive more testing, and they're going to look at places where if there's places where is inherent demand where people want more testing, we want to listen to that because again, as I said at the beginning, there as we know from other states, some places may be running into testing fatigue, or you plan a large scale event and then not as many people show up as you were prepared to test, and that's again part of why we've had some lower numbers than when we've got the ability to process. And so again, if Minot and others have got still got an interest in doing more testing, we're interested in getting there and supporting them, and look forward to working with them. Okay, I'm going to go online and then back to this side.
Mike Smith, 660 KYZ in Williston. Do you worry that the protests could accelerate the spread of COVID-19, especially in Cass County? And do you feel they may undermine the guidelines on large gatherings?
Well, this is we had a call today again with the White House coronavirus task force led by Vice President Pence, Dr. Birx, Dr. Redfield, who leads CDC, was there in the room on the video conference. Seema Verma from CMS, Jerome Adams, who's the Surgeon General, and others. And obviously today, when in a national level with national leaders, governors from both parties on the call, it's hard to talk about the pandemic without talking about the protests, because the largest gatherings of people with no sports going on right now in stadiums, the largest gatherings that are occurring when people are gathering together, for the protests. And I think one of the things we do know is that when one of the ways that this is spread of course, is through, coughing, sneezing, sort of the aerosol droplets. Those can be more prominent when people are singing or shouting. So you get a lot of people in close proximity for hours at a time, all chanting together. It'll be interesting to see in the next week or so if some of these large protest cities end up with a reoccurrence or outbreaks related to that. There are some ideas were discussed on the call. Some states are offering to supply masks to protesters when they're coming. Others, of course, as part of this idea that respecting the rights to free speech and the right to assemble, but please do it with some social distancing. That's kind of hard when you've got when it goes from works better in a peaceful protest than when it turns into a planned riot in terms of the social distancing. But I think it's a concern, and with testing, we'll see where it goes. Again, I hope that in North Dakota that if somebody is planning on joining a protest and has every reason, whether you feel like you've got a sharing the pain of the nation or the injustice that people are feeling right now. But if you are younger, you're more likely to be asymptomatic. If you're younger, you're probably more likely to be protesting. And again, if you're someone who is got people in your life that are vulnerable, whether that's older adults or people that may have underlying health challenges, whether it's diabetes or high blood pressure or cardiovascular disease, and we know that there's that these present real risks for people of both age and underlying health conditions. And so if you're a young person that is going to put yourself in a crowd of people like that, I think you have to be aware of whether you might then choose to socially distance from your loved ones who are vulnerable, or wear the precautions of wearing a mask when you're there, or choosing to have your voice heard some other way. Because I think there is these kinds of large gatherings is one of the things that we're always concerned about in terms of the spread, and now the conflation of those two things together could compound, challenging situation. So that I'd say, and that's some of my thoughts, and some of that's basically a compilation of voices from governors around the country as we discussed this today with the Vice President. I'm going to go Amy, and then Jeremy, and then Jacob, and then back to online.
I have a couple questions for Scott, if you wouldn't mind popping up.
That is fantastic. Thank you, Amy. Welcome back, Scott.
Scott, you had referenced, I believe, 129 positive cases on North Dakota's reservations. Do you have a breakdown, reservation by reservation, of how many cases?
Amy, let me clarify that. That wasn't reservation, that was statewide. That was aggregate numbers statewide, including urban populations as well. But to your second part is, if the tribe so choose, in consultation with the tribe, if they want to get a breakdown, as Margaret talked about, into the matrix and the data, by all means, we can certainly do that.
You don't actually have those numbers, though?
No, we don't.
And then I was also wondering, Standing Rock is doing more, testing in each of its districts, and I'm wondering if similar additional testing is taking place on the other reservations in North Dakota.
Yeah, another good question. I know MHA is they're doing very well on their own per se. We've got another request from MHA last week to provide more testing kits through Chairman Fox on the calls. So we'll be doing that here soon if it hasn't been up there already. And I know Spirit Lake, we just did one yesterday. Yeah, yesterday, with I think 178 tests were up there yesterday. So that was an event in itself. So General and his team were up there yesterday in partnership with the tribe too. So every tribe is a little different. Some need a little assistance, some don't. But as Margaret and her team have said, they're well on their way on getting those districts tested.
Sort of a follow-up for you here. I believe you mentioned that 4.5% of everyone tested in the state is Native American, and yet Native Americans make up about 5.5% of the the population in the state, and the governor's mentioned that it could even be more due to some undercounting in the last census. Do you perceive that to be some sort of disparity, and what would you attribute that to?
Well, you know, when you talk about health disparities in the country, even here in North Dakota with our tribes, I mean, yeah, our health conditions have been very susceptible to, you know, heart disease, diabetes. You know, we do have high rates of those type of health conditions on a reservation because of lack of hospital and medical care on reservations. But you know, but through these partnerships, as Chairman and as Margaret has alluded to, we hope to turn those around here by using this pandemic as an example that, you know, there are partnerships. So I think it's safe to say that once we get past this pandemic, those partnerships are going to continue with our medical teams, health departments, local, private, as the governor's always said, those private partnerships with whether it's Sanford or CHI, whoever that is, and providing better services for my members. Yeah.
For the governor's policies moving forward, a lot of them refer to testing and serial testing and repeat testing and whatnot. Wondering what repeat testing looks like.
Good example was today or yesterday with Spirit Lake. We were up there 2 weeks ago, 3 weeks ago now. Time flies by so fast. And then by request from the tribe again, and I'm assuming it's more of the casino related again, to do another test event. So that repeat testing occurred yesterday with Spirit Lake Nation. So I'm assuming that's going to happen. And my hopes, and I think it's everybody's hopes in the room here, that once that vaccine gets up and running, I know we talked about that with the General Dorman's team, Unified Command team. We may have to repeat that as well once the vaccine is remedied here soon. So I know the tribes are in the queue on that one as well.
I'm going to go back to Jeremy's question on the data, because I have seen that as well, the 4.5% versus 5%. When people are asked about race or ethnicity at the time of the test, it's not a required field. And so we may be undercounting in the numerator where people did not indicate a tribal affiliation, but we know we've got the denominator because we know how many people we've tested in North Dakota. That being aside, we want to make sure that we do have equal distribution of testing across all groups. But again, in some cases where they're more vulnerable, we'll have a higher percentage of people tested, I'm sure, by age group by the time we get done. If you keep doing serial testing in long-term care, we may have, 25% of the people in North Dakota may be under age 18, but they won't be 25% of the tests because we'll be directing those in a targeted way. But in the same way, where we know that there's vulnerable populations within the tribal populations, we want to make sure that we're testing at least at the rate or higher. So we are paying attention to that. Dr. Josh Wynn, who was named last week, who has just completed his service as the interim president of UND and is still the VP of Health Services and Dean of the Med School at the University of North Dakota, coming in as the Chief Health Strategist. Part of the charter of what he's working on includes not only collaboration with local public health, but also with Indian Health Service and tribal health. So for what Scott alluded to in terms of coming out of this, can we build a stronger, better, tighter connection? Absolutely. And I know that he's got an interest in tapping into Dr. Don Warren, who leads the InMed program, the Indian Medical Program at the University of North Dakota, and formerly led the Masters in Public Health program at NDSU, and is a medical doctor, and along with about 3 other degrees from great universities like Stanford. And anyway, Don Warren is going to be a real asset for us, and would be expecting that Dr. Wynn will be tapping him to be part of his strategy task force. Okay, I'm going to go back online, and then we'll come back to Jacob.
Renee Jean with the Williston Herald. COVID-19 cases seem to be rapidly dropping off. Are we getting any indication in North Dakota's data that there's a seasonal component to coronavirus?
This came up on the call today, and I don't think there's anything conclusive yet. There's certainly some hope that when you've got warmer temperatures and changes in humidity, that somehow the aerosol, if you will, transmission is less than it is when temperatures are colder and humidity lower. Some have suggested that maybe this would explain some regional geographic differences around the globe. Some might suggest that this is the difference between, say, New York City and Florida or Los Angeles in terms of the rates, but others would say that New York City, it may have been explainable by other factors, whether how fast people took action to slow transmission, or the rate or the percentage of people that live in high density areas, or the percentage of people that take public transportation. So I would say this is an ongoing debate with no conclusion. Certainly we know that COVID is flu-like in some ways, and we do know that we all know that the flu is seasonal, and we do know that, like in the 1918 pandemic, as I've shared before, of what was at that time called the Spanish flu, there was a lot of deaths in the spring. It went away in the summer. People relaxed, came back. October, more people died in America, hundreds of thousands, I believe, in the fall compared to what they did in the spring. And so, and certainly there was seasonality there. So I think we want to learn from the current data, but be cautionary about history to declare victory too soon. Maybe we'll get a reprieve this summer, but I don't think that would suggest, anybody would suggest, public health leaders at the national level would suggest that we should take our guard down heading back into the fall. Jacob?
Governor, in the past, yes.
Did you have a question, Jacob?
I just have a quick clarification.
Hey. Okay.
Although the First Lady is in the lead with 2 invitations, you did receive one from a school in the Northeast whose mascot is a polar bear.
Okay, but we were talking about tribal schools. Okay, but that's okay. I'm happy to know that I didn't get completely blanked out. Good news, I did get invited to, apparently by the Larimore Polar Bears, to speak at graduation. And I was honored to include a few words in the virtual graduation. But I think we were talking. I'm still down 2-0 on tribal invites. Okay, Jacob.
I hope you get your call soon. In the last week, the president has referred to certain governors as weak in their response to covering protests, and has, when he addressed the nation, said that some governors should try to dominate some dangerous crowds. We've seen some demonstrations around this state, wondering how your approach differs from what the president wants.
Well, I think what we saw on Saturday night in Fargo, and I was there, so I got to see some of it firsthand, was again great collaboration between local police departments, Fargo, West Fargo, Cass County Sheriff's Department. We had great response. North Dakota Highway Patrol, within hours, had 1/3 of the personnel North Dakota Highway Patrol in Fargo, including a rapid response mobile team. We had the National Guard was training in Fargo and were readily available. The group that was training there was the group that's actually got experience in training in crowd control and support roles, and so they were within minutes of when we got the letters from West Fargo and Cass County and the city of Fargo asking for assistance, we were able to deploy the Guard. So I think that we saw planning, we saw agility, we saw nimbleness, we saw speed, we saw collaboration, and of course, a lot of good coordination between all of those leaders. I spent many hours in the command center on Saturday night, and again, between all of those different organizations, coordination matters, and they were up against, by Saturday night when things started to happen, up against some trained professionals, and that was again, in spite of that, came away with no arson, no serious injuries, minor minor vandalism, and I would say that great success. Now, hopefully, people will understand as people are planning these things, that they understand that North Dakota, where we respect our neighbors, we respect the rule of law, we respect the right to the First Amendment, we respect the right to assemble freely, but we do not, tolerate just blatant lawlessness. And I think it's coming off the funeral yesterday for Officer Cody Holte, who represents the very best of us, someone who is served in the Army as his twin brother did, served in the Grand Forks Police Force, his twin brother serving in the Fargo Police Department. I mean, this is a family with all the right values that would make anybody proud. And, young father with an 11-month-old. This is a guy that, literally ran into the line of fire to save other people's lives. And I think as we think about those who, would blatantly have a disregard for the rule of law is what allows all of our freedoms to stand in our country. It's what allows us to have free speech. It's what allows us to enjoy the prosperity that we've had in our country. And while there are there's an opportunity and maybe even a moment here for us to think about, broadening a dialogue around justice. I think there's a way to do that, and do that when we're with, not just as we pursue peace, but with peace in our hearts as we do that. And I just have got nothing but positive things to say about the law enforcement and first responders that were there in Fargo and across the state, have been finding this right balance in terms of respect and dignity for those that want to share their voices, as you get to do in this country, and a right that we fight to protect, but not having tolerance for people that, again, break the law, because that's we have to just find that line. And we have to understand that this is some of this is not random. Some of this is actually well organized. We know that was the case with the people that were in Fargo, and that's a very different thing. It feels like organized crime. It doesn't feel like a voicing your First Amendment rights. There's a real difference between that, and we have to. What happened earlier in the day on Saturday with the march was well executed, well managed, and points poignant and beautiful in terms of the interaction and the dialogue that was occurring. And what happened on Saturday night was the complete opposite of some of that was a complete opposite of that. We have to be able to make a distinction between the two and move forward. Okay, I'm going to go online and then back, then to Lane.
Scott Hennon, WZFG, KFYR Radio. Another protest is happening Friday in Fargo. Since these protests have large participation that may exceed state guidelines, would you recommend that permits not be granted by cities because of the COVID threat?
Well, we're having a discussion with some city leaders tonight around that topic. I think the other tactic which we've seen around the nation and which we saw is that a permit's applied, a group is organized, a route's approved, and then once that starts, then the routes are not followed, and so I think again. And when they're trying to deviate from the route, they're trying to get into a spot where they can create, action and video. I mean, everybody's got to understand there's two things going on here. One is the actual kind of battle on the ground. And when we're talking about a riot, there's a battle on the ground where there's physical activity happening, but there's also an information battle where the people that are trained in these tactics are actually what they're trying to get. They're not trying to break a window. They're trying to get video that will support their narrative. And the most amazing thing of all is that through everything that went on, say again on Saturday night, I don't think you can find a video online that would show anything other than professionalism and restraint by law enforcement in North Dakota, and that's a hallmark, I think, here. But it's a challenging to maintain that posture when people are throwing 3- and 4-pound rocks at you and water bottles and expletives and damaging property. But it's, again, this is the, one of the worlds we're living in is we're fighting two things at the same time. And I think, again, there's sophistication in North Dakota that understand that we're fighting a physical and an information battle. And I think on Saturday night, largely came out in good shape on both of those. But that makes it makes things very, very difficult. And again, I'm separating that kind of activity from everyone's right to voice. I think what's be more productive, and we made the invitation on Sunday morning, but if there are people who live in North Dakota and are in communities in North Dakota that feel that that they want to have a dialogue with myself or with mayors or with anyone about what justice feels like, we're happy to sit down with people. And I think that, again, let's have a productive dialogue. We're a state where people can sit down and work together. And as opposed to anonymous acts of lawlessness. If you're really for a cause, then stand up, share your name, reach out to us, identify your organization, and let's sit down and have a conversation. I think we've got a deep track record of willing to listen and create space for dialogue, and we're happy to do that. So if anybody's got a grievance, would want to let them know. But again, haven't heard from any of the protest, the riot organizers on Saturday night. None of them have reached out to our office, but I'll extend that offer again. Happy to talk to them. Just tell us who you are and let's get together and visit. Okay, I'm going to Lane and then back over here. Lane?
Governor, was wondering if you had an update on the antibody testing going on here in North Dakota. It seems like forever since we last had our press conference, but if I remember correctly, we were waiting on some results.
Let me just check, Lane, and see if I have an update here. It wasn't part of our, this is on the serology testing. These are the blood tests. Are they available now? They were the ones that were sent to the lab. They've made it through validation. They're now available through healthcare facilities. If an individual has a question about availability, they should reach out to their healthcare provider. And these point of care serology tests, those are being validated again, and those testing events will be targeted areas where serology tests would be most impactful, including areas where disease rate is high. So I don't know if that specifically answered your question or not, but it sounds like it's either some are going out the door and some are going out the door soon. And this would be the test to find out not whether you're positive or negative, but whether or not you've actually developed antibodies. So
Got any of those back?
I know that they've done. I know that they had done a bunch. I think I explained last week they were doing two things. They were doing the finger prick test at the same time they were doing the blood draw, and then comparing the results between them. And I'll make a point to see, because I think there was hundreds, if not many hundreds of those tests that had been completed. And if we got those results, I'll see if I can share them on Friday.
They're also on the Department of Health website.
It's also, they're posting now on the Department of Health website. Okay, so from Mark Staples through the mask says they're on the serology test results are on the website. So maybe that question, you don't have to wait till Friday, you can look it up.
2,921 total tests and 97 detected.
Okay, say again, 2,921. These are serology tests, testing for antibodies.
And 97 detected.
Only 97 detected, so I'm just going to say that's less than 5%. So we were, so that's a long way from herd immunity, but good data. Jeremy, and then Dave. I'm sorry, Dave.
You mentioned that
Dave's like the guy at the Sotheby's auction that you can barely see him raise his little pen up. You have to really be really listening for the little nod there.
Don't need to talk loud.
You mentioned that the state has the capacity to process 4,000 tests a day. I'm wondering if that comes with an accompanying goal to perform 4,000 tests per day.
Yeah, we have. We're taking a look, and the team will be back here on Friday trying to outline what we want to do for June in terms of the. Because it's a combination, as we said before, what the state lab can do, what our partners can do, what our testing partner in North Carolina that we've been working with, that we want to do this, and how we want to get it done. Because as I said, some of the reasons when we've been falling short of our goals is we've planned to have that many tests done in a day, and then we've had people not show when we had testing events. So we've got to change our strategies, or change our incentives, or make it easier for people. Learn from Standing Rock. Go to where the people are. Go to where they can do a walk-up. Let's think about walk-up testing as opposed to drive-up. I mean, there's some things that we've got to do differently, that we've got to own on our end to get these numbers up.
Is there any consideration for possibly expanding the criteria for somebody who can get tested?
Well, absolutely they'll be expanding, because I mean, one idea we've just talked about today is if we've got the capacity and there isn't demand from people that are showing up at clinics that are systematic, I mean, could we, as a sample, say that of the places where say as we start to get through the nursing home thing, and we're talking about testing staff on a weekly basis, we might have enough testing capacity to pick some nursing homes and say, that all visitors going into certain nursing homes need to get tested. And they'd say, well, why are you picking on us? Well, we might, if we did 10 nursing homes and tested every visitor that came in and found out that, 1 in 10 visitors was asymptomatic but was positive, then that'd probably get us to rethink our visitation approaches. And I do think we need to also take a look at, universities. We got a lot of faculty on universities over the summer. We got summer students coming back. We haven't really done any testing there, but when we start thinking about how do we get smart about testing for dorms, I mean, dorms are congregate living, and there's been nobody living in dorms in North Dakota during this whole event. But if they're back next fall, I mean, we'd have out of 45,000 university students in North Dakota, I mean, you could have a quarter of them living in dorms. That would be larger than any other congregate living population, including long-term care and the correction system. And so, what is the testing capacity we need for that? So we got to be thinking, in the future about how we want to do this as well. Dave?
It was a recent briefing, you were saying that the trend line in terms of the people applying for unemployment benefits seemed to be going the right way. I was just curious if you have any new figures on unemployment and people seeking unemployment benefits, and also what our current unemployment rate is.
Dave, I happen to have some numbers with me, so thank you. Weekly certifications. A certification is when someone affirms that they're still unemployed. They continue to trend downward. In the last 3 weeks, we've seen a decline of 8,199 weekly certifications from the peak week, which was May 3rd. It's a 14.7% decline. This decline is in large part the result of individuals returning to unemployment. Cumulative benefits that have been paid of all types together now total $366.6 million of both the regular and the pandemic unemployment, and the PUA, the PEUC, and the FPUC, those 4 different programs, $366.6 million. And then last Tuesday, again, claims coming way down. Regular claims 430, the PUA 133, and PEUC 154. So those are way down from the highs. And because we have transferred in $110 million through the CARES Act funding, which was approved by the Emergency Commission and came out of the recommendations we met in that initial round. $110 million went into that. The trust fund balance is at $192.4 million. So we got a nice balance in the trust fund as the numbers continue to decline. I would say that, again, we're not going to understand the true rate of unemployment in the nation or in North Dakota until the expiration of the extra $600 a week goes away, because I hear story after story after story from employers that people are doing everything they can to avoid returning to work if they can continue to draw more money. I mean, that would make economic sense. If you can make more money on unemployment than you can at your job, I understand the strong incentive to do that. So I would, I guess we'll know what the real unemployment rate is when it's more of an equalized. Okay, I think we're at that point at the end of the day where we want to say thank you. For those that are wondering what Lane's wearing today, he's wearing the colors of KX News, blue today. No sports teams today, but looking sharp. I want to thank all of you for being here again, and thank you, Chairman Fay. Thanks, Margaret. Thanks, Scott Davis, and thanks everybody, especially that was watching today and viewing today, because your attention and presence really matters. We're grateful to you for everything you're doing to focus on the facts, not on fear, and thanks for helping keeping North Dakota in such a positive direction. Have a great day. We'll see you Friday at 3 p.m.